Hi everybody, I found an incredible story I want to share with you, and if you're living with multiple sclerosis or you know somebody living with multiple sclerosis, this story actually applies to you. So let's get started. And this format is not my usual snarky or silly reports about my symptoms with multiple sclerosis, but rather a really important story that I think history kind of forgot. Alright, so let's imagine for a second we have a disease that slowly steals our vision, our ability to walk, and there's not a doctor on earth that can tell us what's wrong with us. Well, that has happened to some of us, but let's step back to the year 1822.
Oh, do join us, old boy. Loosen up a bit. Not tonight. There's far too much to document.
The grandson of a king began chronicling a terrifying condition he was experiencing. He would document in extreme detail his 26-year decline into paralysis, suffering from a phantom illness that no one in the time could explain or even help him with. Today, we know this disease as multiple sclerosis, and we look deep into the nervous system using advanced MRI machines, and now even blood biomarkers. But the true genesis of understanding multiple sclerosis didn't happen with the technology we have today. This is the forgotten story, how art mapped a medical breakthrough.
All about it. Fresh roses, penny each.
In the early decades of the 19th century, the human nervous system remained a vast, uncharted continent. For those suffering from progressive paralysis, muscle spasms, and loss of vision, there were no known names for their suffering, only a generic catch-all phrase of paraplegia. Enter Augustus D'Este, a grandson of King George III, who meticulously recorded 26 years of his own physical decline. He described the typical relapses and remissions of a disease that no living physician of his time could diagnose. And the answer to this mystery would not come from clinical examinations, but rather a meticulous observation of the dead.
As you can see, the malady affects the frontal cortex.
The very first person to paint these mysterious lesions was a young Scottish physician. Enter Sir Robert Carswell. Working in the post-mortem rooms of Paris, Carswell possessed an extraordinary talent for capturing diseased tissues with unmatched artistic fidelity. By drawing directly onto limestone, Carswell published the world's first color illustrations of multiple sclerosis plaques in his 1838 Atlas. He classified these strange hardened patches along the spine and brain as atrophy. Yet because he never examined the patients while they were alive that had these lesions, he really didn't understand the impact of these lesions on their lives. While Carswell provided the first drawings, his French contemporary Jean Cruveilhier achieved a clinical breakthrough. Cruveilhier examined the body of a deceased patient and described what he termed as gray degeneration.
I call it gray degeneration.
He noted that the protective white matter around the spinal cord had been replaced by reddish-gray islands.
The white matter of the spinal cord vanished, replaced by reddish-gray islands.
But Cruveilhier would go a step farther than Carswell. He linked these post-mortem scars to patients he had known while living that had things like tremors, spasticity, and walking difficulties.
The patients, while living, had tremors, spasticity, and walking difficulties.
And for the first time in history, the clinical symptoms of multiple sclerosis were definitely tied to physical damage in the spinal cord. But then came the question, why did these scars appear where they did? Why were they on the sides of the spinal cord? And modern biomechanics can actually explain this, and this is incredibly interesting. You see, the spinal cord is held in place by lateral ligaments. During extreme movements of the spine, severe stretching forces are concentrated exactly at the points where these ligaments attach to the side of the cord. This physical tension causes localized tissue damage and vascular stress, initiating an inflammatory cascade. And this perfectly explains why early anatomists found these wedge-shaped scars along the side of the spinal cord. The very geometry of the disease would be dictated by the physical forces acting on the human body. And in 1868, the pioneering neurologist Jean-Martin Charcot gathered these drawings together.
It's pronounced Charcot.
And added his own clinical observations. And get ready for this, he formally named it sclerose et plaques. Over the next 100 years, scientists would discover the role of myelin, identifying the autoimmune nature of the disease, and in 1981, introducing the first magnetic resonance imaging, or MRI. And this is fascinating because today, when a neurologist views an MRI scan to identify the plaques in multiple sclerosis, they're looking at the same exact physical anomalies that a young watercolor artist documented almost 200 years ago. And I just want to say thank you, D'Este, for your hard work. You were doing your own level of advocacy before advocacy was even a thing, before MS was even a thing. And that made change. That made things happen. And because of that, today, we know what MS is. So you're awesome. I hope you found this episode interesting. These are just 3 very fascinating characters from history and how they help shape our journey with MS today. Now my question to you, are you keeping a diary or are you leaving it all up to social media to track your journey? I'm Cliff, this is Life with MS, and I'll catch you in the next episode. And I'm out.